Hi everyone, I am Dr. Mona Shah, and today I welcome you all for discussing inflammation, diet, and what it can do to our cardiovascular health. Just a little bit about myself. I am Dr. Mona Shah. I am a cardiologist at Baptist Beaches. I practice preventative cardiology, non-invasive cardiology, and focus on women's health, general prevention. A little bit more about myself. I got board certified in holistic medicine several years ago because I realized that a lot of the patients, and even for me, I wanted to treat a bigger picture, the whole picture, as opposed to just doing some testing and giving out drugs, et cetera, which is important. But I really felt like a lot of my patients' issues were deeper than just giving them certain medications. And so I felt like it was very important for me as a holistic cardiologist to address diet, stress levels, certain vitamins that can be helpful, and herbs. So that's what a holistic cardiology does. At least that's what I do in my practice. So I did a Facebook Live actually about stress and what it does to the heart and how it can affect inflammation in our bodies last week. Today I'm going to focus for all of you on diet and inflammation. And really try to get through as much as we can. I know we've got about half an hour. I'm going to try to stick to it this time. And if we can get to certain vitamins, some of the key ones, I will try to get to it as best as I can. So let's dig in. And inflammation. So we know that inflammation is now really a strong contributor in most chronic diseases. We know that inflammation takes part in causing cardiovascular disease, Alzheimer's, diabetes, migraines, inflammatory bowel disease. The list goes on and on really about what inflammation can cause and what kind of diseases it can contribute to. And we know this. That's why there's so much information out there now on trying to be anti-inflammatory. Everything you see out there, whether it's vitamins and herbs and diets, everyone's trying to focus on anti-inflammatory because we know that so many of these chronic diseases are caused by not only inflammation, but inflammation plays a big role in it. And we also know that most adults, when we go to the doctor, it's not because we have the cold or the flu, it's because we've got some chronic disease, high blood pressure, diabetes, etc. So really, this is an important topic to address, and it's near and dear to my heart, especially nutrition. And I really hope that we get, and I answer people's questions, and I hope we get a lot accomplished in this next half an hour. We also know that most people, when they die of a chronic disease. They die of either cardiovascular health, which is the number one, myocardial infarctions and heart attacks, strokes, these kind of things. These are the number one cause of death, and these are caused by chronic inflammation. Now, let's clarify a little bit here. Chronic inflammation is very different than an acute inflammatory event. So when we get a cut or a scrape or we get sick, we need inflammatory markers in our body to go at it and help heal our bodies. That's not what I'm talking about. It's not that we don't want to have any inflammation in our body. It's that chronic stimulus that we get all the time through different outside sources, which we're going to get into. That's what I'm talking about. That's what I'm going to focus on. Okay. So I hope you understand the difference between chronic inflammation and acute inflammation, that we actually need our inflammatory cells to help. So let's talk a little bit about, I'm going to break down what inflammation specifically does to the heart. So let's go even more basic. What is a heart attack? So a heart attack itself is, we've got arteries supplying our heart muscle. They actually go on the outside of our heart muscle. And we know that when there's a blockage, okay, I'm gonna actually show you one slide. I'm not gonna do a whole slide presentation for you, but there's one slide I do wanna show you because I think it drives a point home. So when the artery supplying a certain muscle gets blocked off, there's not enough blood flow, there's not enough oxygen, and then that muscle dies, okay? So that's a heart attack. So in that artery, if we look at the artery a little bit closer, I'm going to show you just one slide, okay? Hopefully this works. Let's see if I can show. Okay, so I'm going to duck down a little bit so you can just look at this real quick. And what I want you to look like, this is an artery, okay? And that yellow in there is all the gunk that you find inside a plaque, cholesterol, inflammatory cells, platelets, etc. Now, what I'm going to be focusing on, you see that white outside covering? That's what keeps that plaque from staying down there. So as a cardiologist, we know that when I have a patient who's got a 70 or 80% blockage, okay, those are the arteries that we put the stents in, or if they need bypass, they need something usually. Those are sometimes my easier patients because they'll come to me and say, hey, I used to be able to run a mile or 2 miles, and now every time I run a certain amount or walk or do any sort of activity, I have heaviness in my chest. So I know they've probably got most likely 70 or 80 or even worse blockage, but it hasn't caused any damage yet. So we try to get them, into the hospital and do whatever we need to do to fix that blockage. The issue is most people are not running around with 70, 80% blockages. Most people are running around with 10, 20, 30, 40%. That's going to go under the radar for the most part because you're not going to have symptoms. You're going to pass a stress test. Stress tests are not designed to pull out a minimal blockage. But if you remember that picture, I'm going to show it one more time. If I remember this picture, what happens is when you, let's see, that's good. So if you imagine, let's say that looks a little bit more than 20%, but let's just assume that's a 20% blockage, okay? When that white, you remember that little white cap that was covering up and keeping everything down in the artery? When that little white protective cap has a little tiny tear or ruptures, that is what causes that 20% blockage to all of a sudden go to an 100%. Okay, so these are the people that you hear had a stress test last week, ran a marathon, and then all of a sudden they died of a heart attack. So this is what us cardiologists are trying our best to protect. And how do we keep that 20, 30%? How do we keep that white covering, that cap there and strong and thick and not have little ruptures? We do know what can cause some of the ruptures: high blood pressure, smoking, diabetes, uncontrolled, being overweight. All those things can contribute, high cholesterol, all those things can contribute to that white covering having a tear, breaking up a little bit, and then all of a sudden, again, you have all that gunk, I want to call it, inside go from 20% to 100%. Okay, so, but we also know that a lot of patients, they don't have high blood pressure. They don't smoke. They don't have a family history. They don't have diabetes, but they're still having these plaque ruptures. So what we know is that inflammation is a big part of what causes that white covering to rupture, that can cause it to rupture open. So we really need to get on top of what causes inflammation. Now, and medications can help, don't get me wrong, but remember, they're just kind of a Band-Aid. You still, if you're not, and since today is on nutrition, if you're not having a good nutritional diet, then you're gonna still have inflammation going on in your body. I don't care how many drugs you're taking or how many medications you're taking, you are still gonna have that inflammation. Okay, so I hope that was pretty, I know it's kind of basic, but I hope you guys got an understanding of heart attacks and how they happen and how inflammation can cause that. Now, the biggest reasons that people have inflammation in their body, the biggest, is from what they're putting in their mouth, okay? And I'm gonna focus on food. There's other things you can put in your mouth, I guess, as far as alcohol and all those kind of things, but I'm really gonna focus on the diet and what we're eating, because that's the biggest cause of inflammation over and over and over and over again. So let's talk about that a little bit. I am not a fan of diets at all. I really don't believe in, you know, Atkins, and then there's paleo, and there's just so many. Keto is a big one. You know, I'm not saying that it doesn't help sometimes to get on some sort of a routine or some sort of diet to help kickstart your process, but it's got to be a lifestyle change, okay? It's really got to be where you're really making a lifestyle change and not doing something for a week or 2 weeks or even for a few months, because you got to find something that's sustainable. Because if it's not sustainable, I can't tell you how many times I'll see patients, they have their heart attack, they have their stent, they come back, they're doing great. They're on this diet and that diet. Well, a year later, they're either worse off than they were as far as weight gain and diet, or back to what they were beforehand. So that's why I really try to encourage patients, really try to do something that you can sustain. Now, as far as lifestyle goes, really the best studied, again, I call it diet, but I really mean nutrition, lifestyle, is Mediterranean. Okay, so the Mediterranean lifestyle has been shown many, many times to decrease heart attack risk and cardiovascular death. Some studies have been up to 25%. That's more than most drugs can do. Okay, and not even talking about obesity and weight loss and diabetes. I'm just talking about cardiovascular health itself. So what is the Mediterranean lifestyle? Most of you probably already know, what it entails, but I want to dive into that a little bit more. So it's healthy fats. So let's talk about fats first. So fats are very important, because I know a lot of people are really into the keto diet. And there's a way you can do higher fat diets, but most people just end up diving right into the saturated fat. So they're doing tons of coconut oil and like the bulletproof coffee with butter. They're doing tons of cheese and a lot of heavy meats and a lot of saturated fats. So what's really important is trying to focus on the healthier fats. For example, those are monounsaturated fats. So what are monounsaturated fats? So there's 3 types of fats. Let's back up just a little bit. There's saturated fats, okay? That is coconut oil, butters, whole milk yogurt, cheese, red meat, all that kind of stuff. That's all chicken. That's all saturated fats. Those can be good in small amounts. All right. Trans fats is the worst kind of saturated fat. That's the partially hydrogenated oils, some of the vegetable oils. A lot of the junk food that we talk about, not only do they have sugar, a lot of people focus on the sugar part of junk foods, but if you look at, they're not making Oreo cookies with olive oil, okay? So they're using like the worst kind of oils possible that raise your saturated fats a lot and cause a lot of inflammation. So again, it's okay to have some saturated fats, but in my experience, most people I see have way too many saturated fats. You want some, but you want to maybe have, if you're going to use coconut oil, don't have more than a tablespoon. I'm actually not a big fan of coconut oil. I just tell people use it on your skin. It's really good on your skin. If you're going to have saturated fats, maybe do butter. If you're going to do butter, you really want to try to do grass-fed butter. Don't get margarine and, things with a million ingredients on the butters that say it's healthy, but really it's just 15 ingredients to make something look like butter. Do small amounts of cheese. Do an ounce of cheese a day. That's okay. If you're going to do even yogurt, I actually think people should do whole milk yogurt because it actually has less fillers in it and less carbs and sugars in it. So, you really want to try to stay with less saturated fats. What about monounsaturated fats? That's the way to go. So if you're going to do a higher fat diet, lower carb diet, you really want to try to do more monounsaturated fats. Avocado oil actually is wonderful it's a higher temperature that you can cook with, unlike olive oil. Olive oil is great, but it's hard to cook high temperatures with olive oil. So avocado oil is great. Macadamia nut oil is another one. Macadamia nuts are really good. So these are some of the monounsaturated fats that you want to focus more on. And then there's polyunsaturated fats. That's your omega-3s and omega-6s. So omega-3s are your fish, okay? Those are really good for you. You want to definitely have some omega-6 in your diet, but you want to make sure that it's more omega-3, okay? Omega-3s are like the fish and the fish oils, walnuts, macadamia nuts, nuts, all those kind of things have a lot, flaxseed, those all have a lot of omega-3s. And you can have some omega-6s, but you really want to try to focus on the omega-3. So again, going over fats, you really, when you're looking at things, you want to say how much monounsaturated fats does it have? That's what you want to focus on. And less saturated fats. Definitely trans fat should be close to zero. I mean, once in a while, if you're eating, you know, having a celebration, having birthday cake, then have it and enjoy it. But that should be like once a week at the most. You know, it should be a rarity. It shouldn't be something that you're doing every day. So that's my spiel on fats. I don't know if anyone has questions about any of the fats or the oils. I know I get a lot of questions about canola oil sometimes. Canola oil, I'm not a fan of at all. I mean, there's not even really a seed called canola. It's very processed. So since there's so many other healthier oils out there, you know, why not use some of the other healthier oils instead of using the processed oils? When we look at carbohydrates, okay, in the Mediterranean lifestyle, it's really whole grains. Whole grains, and I'm not saying you have to do gluten-free necessarily unless that's a problem for your GI system, but you really want to focus on whole grains. And so brown rice, quinoa, sweet potatoes are fantastic complex carb. Even having regular potatoes sometimes can be great. Whole grain bread, a whole grain pasta. Again, some of those pastas and breads, it's okay to have some. I mean, I wouldn't have it every single day. But if you're going to enjoy bread, you know, have a good whole grain bread. And look at the ingredients. I mean, you're going to hear me say this over and over again, so I'll kind of get it out of the way. But ingredients are probably the biggest thing that I want people to, if they get anything out of this, it's look at the back of a label. Look at the back of something, because it's there where you're going to find what's really in it. You know, labels on the outside can say whatever they want, healthy, low fat, low this, low that. But really, when you turn it around, if there's 5, 6, 7, 8, 9 plus ingredients, it's probably something you don't want to have on a regular basis. You really want to try to focus on whole foods, okay? Foods that their ingredient is what you're eating. And, you know, as far as sugars go, that's another big part of the carbs. You know, when you look at carbohydrates are usually fiber and sugar. Those are usually what they are. And so you really want to have sugar. You know, talk about inflammation. That is one of the biggest culprits out of all the diet stuff and some of the oils that we talked about. Sugar is the hardest and the hardest one to give up for most people, and one of the biggest causes of cardiovascular disease, inflammation, diabetes, obesity, you name it. So sugar is very interesting because a lot of stuff has added sugar in it. I mean, again, you won't know unless you look on the back of a label. And I think a lot of labels now will actually tell you what is the sugar that's part of it. You know, like if you have milk or yogurt, just plain, there's going to be some sugar in it, and that's okay. That's a natural sugar. Like fruits have natural sugars, vegetables have natural sugar, and dairy has natural sugar. That's okay. But there's some yogurts, you might as well have a Gatorade. I mean, because the amount of sugar that they're adding in there is like 4 to 5 teaspoons at least. And you really don't want to have that much added sugar. They really recommend you have, you know, close to 20 grams of added sugar a day. That's not much. That's really, really not much. So again, I implore you all to look at your ingredients, look at your labels, and see how much added sugar is it, how much fiber is in it, what are the carbohydrates, what are the ingredients that they're putting in it, what kind of oils are they even making this with. And then circling back to sugar again, you know, if you like things a little sweeter, I tell people buy whole milk plain yogurt. And using yogurt because that's one of the biggest things where people think they're eating healthy, and lo and behold, they've just, you know, done with their whole sugar allotment for the day because they just had a flavored yogurt. Buy whole plain yogurt, you know, put blueberries or raspberries or certain fruits in there, and then if you want to sweeten it, use either stevia or monk fruit extract. Those are the two more natural type of sweeteners that I'm comfortable with, that I use personally. I am not a fan of Splenda, which is sucralose, you know, aspartame, Equal, what's the other one? NutraSweet or something like that. Any of those are very chemically processed. They're not coming from anything natural, as opposed to stevia and monk fruit extract. I do get a lot of questions about honey and maple syrup. Those are better you know, but they still have a lot of sugar in it. So if you're using a tablespoon of honey and that's your sugar for the day, go for it. You know, but if you're having a tablespoon of honey and then you're eating, you know, bread with a bunch of sugar in it, and then you're having yogurt with a bunch of sugar in it, well, you've just went way above your sugar allotment. So that's my spiel on sugar. Let's talk about, we talked about carbs, fruits and vegetables. You know, what can I say? Have as much as you want. I will say this about fruits. You can, okay, so if I have to tell someone to pick between a watermelon and grape, or, you know, a chocolate chip cookie, of course I'd rather them have a watermelon and grape. But know that if you're diabetic or pre-diabetic, or you're really trying to watch your sugars, be careful with some of the fruits, because mangoes, grapes, watermelons, pineapples, they all taste so good because they're loaded with, they're natural sugars, but they're loaded with a lot of sugar. So again, it's not about never eating those fruits, but if your daily fruit is all those kind of fruits, you might want to back off on some of those and focus on berries. Berries, really, you get so much bang for your buck. They're low in sugar, excellent antioxidants. They've got fiber in them, and again, they're lower in sugar. So I really think if you're gonna want fruit, focus on berries, and then add in some of the other ones like grapes and watermelon, pineapple, kind of as a side. Vegetables, really, I can't think of any vegetable that I would never recommend. So I think vegetables galore is what you should be focusing on. I'm gonna circle back to some of the proteins and fats a little bit, because there is a lot of debate and question about what kind of fats to eat and what kind of animal proteins to eat. So we do know that in the Mediterranean lifestyle, at least, it's more focused on fish and lean meats. Now, I tell, if you're my patient, you've already heard this probably a million times, you know, red meats, bacon, sausage, cold cuts, hams, all that stuff should be as rare as possible, maybe once in 2 weeks, because I cannot tell you how much inflammation that causes for your body, let alone your cholesterol numbers and all that. But even if you take that out of the picture, the inflammation that some of those processed meats cause is incredible. So it's really, really important, if you're gonna do meats, try if you can to do organic, grass-fed. I tell people, if you don't wanna be plant-based, which, you know, to each his own, definitely want to at least have maybe one plant-based meal a day, okay? And then if you want to have animal proteins, try to focus more on being a pescatarian, and then throw in, you know, chicken here and there as well. You know, beans are great. Having some brown rice with that is great. Vegetables are great. Eggs are good in small amounts. If you like eggs, maybe do an egg and an egg white, and some vegetables with that. So I think that, you know, again, you don't have to be vegan or even vegetarian, but try to even think of, I've seen a lot of websites that have meatless Mondays, you know, sometimes. So maybe have a day, at least 1 or 2 meals where you're not having any animal-based proteins. I think that most of my patients who do that notice a significant change in just how they feel, and let alone they're so happy because their numbers come down, their blood pressure comes down, their cholesterol comes down, and they've cut down their risk of cardiovascular disease. So I think that's a pretty good overview, unless somebody has specific questions about fruits, vegetables, fats, and certain proteins, and then the sugar. Again, the take-home points, look at your label, look at the back of your label, and see what kind of ingredients they're putting in it, what kind of oils are they using to cook in it. Try as much as possible to have whole foods, as less processing as possible. So for example, for breakfast, you know, if you're gonna have an egg and egg white omelet, you use olive oil to cook it, or avocado oil with some vegetables. If you want oatmeal, you know, don't buy the packaged one, just buy the plain oatmeal. You can buy the quick oats too, and put some blueberries and cinnamon. And you know, if you like milk, you can do regular milk. If you're trying to stay away from dairy, you can do the unsweetened almond milk or unsweetened coconut milk. Try also not to have carbs that, even if they're good carbs, carbohydrates, try not to have any carbohydrates for every single meal, you don't want to have carbs. So if you have oatmeal for breakfast and then you're having whole grain bread for lunch and then you're having a bunch of brown rice for dinner, that's probably still going to be too much in the way of carbohydrates. You want to focus most of your meal on fruits, vegetables, healthy proteins, and then have some carbohydrates there, but they should be not the biggest part of your plate, okay? I think we're going to, I think that's a pretty good overview. Like I said, unless someone has any specific questions about diet and inflammation, I think I've covered a lot of, you know, what kinds of foods to focus on. I know this is interactive, and I'm trying to think of the other questions I get normally when I give this talk. A lot of it's about sugar. Alcohol is a loaded question sometimes. So usually what we recommend as cardiologists, there's been enough studies that show if you have 1 to 2 drinks, and I mean measured out drinks, okay? So most people when they're pouring wine, I don't know if they're measuring out 4 ounces, but a glass of wine is 4 ounces. So, 1 to 2 a day. Now, women, it's a little bit trickier because there's enough data to show that women who drink every day could be at increased risk for breast cancer. So that's something you want to kind of weigh, maybe something in between, have 3 to 4 drinks a week instead of 1 every day. That's something that, something to think about and ponder on. It definitely wouldn't do more than 2 a day for sure, because that's not, it actually, your heart disease will go up with too much alcohol, let alone the liver and everything else that goes with it. I do also get a lot of questions about organic and how important is it to get organic. If you go on environmental working groups, if you just Google environmental working group, their website, it's phenomenal. It'll actually even show you in your area what kind of fish is, again, even when you're doing more fish, you want to try to really do wild, okay? Because farmed, they put dye in it to make it look pretty and pink, and it's not healthy to eat farmed fish at all. But and you want to, mercury levels are important too. So you want to, environmental working group actually has a good website where you can look in your area which fish are higher in mercury. And it'll also tell you which, it's called the dirty dozen. So the dirty dozen means the dirtiest dozen produce. So those are the ones, maybe in those cases, spend a little bit more money and try to go organic if you can. You have to buy organic everything, but maybe the ones that are known, raspberries, spinach, those kind of things are more known to have more pesticides, okay? And then there's the clean 15 foods. Those are the cleanest 15 foods on the environmental working group's website. So it's a really good website. You can kind of learn what has more pesticides, what doesn't, what should you go organic in. Like I said, fish, you really want to try to stick to wild. If you're going to do meat, try to do more grass-fed, organic. Same with the eggs, if you can. I know this stuff can kind of add up cost-wise, so you're going to have to kind of sometimes pick your battles for that. As far as vitamins, I'm going to talk about vitamins. I'm probably going to talk for just another 5 more minutes, and then I'll see if there's any other questions or anything like that. So vitamins and herbs and all that kind of stuff, it's a lot to get into, but some of the most important vitamins, if you listen to my stress talk, you heard me talk on and on about magnesium. Magnesium is used in over 300 different body processes in our body, and most people are deficient in it. And getting a blood test isn't as useful because most of the magnesium in our body is not running around in our bloodstream. So magnesium is one of the best antioxidants and anti-inflammatories there is. It's very hard to, you can get it in foods, nuts, mushrooms, some legumes have magnesium, but you usually still can't get enough just through diet. So I usually recommend getting magnesium in a supplement form, and I usually recommend people taking it at bedtime. Once this is all done, we're going to post a slide that has a little bit more details of what kind of magnesium to get, what kind of magnesium to avoid, and the doses. So that, because last time I did the talk, there were a lot of specific questions, so I just made a kind of a quick slide that people can use. Magnesium, the only thing is that, if you have kidney failure, you're on dialysis, you really want to talk to for any vitamins you start, you really should talk to your doctor about it, because could interact. It could make your blood thinner. You want to just make sure that everything you're taking, everything kind of goes together. So magnesium's a great one. Turmeric, that's curcumin, is a great herb actually It's an Indian spice, and it's a great anti-inflammatory. Again, it's extremely hard to absorb curcumin and turmeric. So it's another one that you really want to get that. If you look at the ingredients, if it just says curcumin on it and doesn't say anything else, it's probably a waste of time to buy it. You want to buy one that has either black pepper or something in it that says that that's how it helps get absorbed. Turmeric, they've even done so many studies on curcumin for heart disease, migraines, inflammation, arthritis, and it's a phenomenal anti-inflammatory. It's probably one of the best anti-inflammatories naturally that there is out there. As far as other vitamins, vitamin D, I'm a big fan of because it's really hard to get. I know we live in Florida, but I can't tell you how many times I'll check people's vitamin D levels and it's still low. A lot of us wear sunscreen, as we should, so who knows how much we're absorbing. It's extremely hard to get in food. So usually low vitamin D levels have been linked to depression, high blood pressure, certain cardiovascular diseases. So I do think that vitamin D is important to take in a supplement form just because it's so hard to get from outside sources. But I do also think vitamin D is a level that your doctor can check and see how much you need, because you can, and some people can overdo vitamin D when they take it in a supplement form. Another big one that I'm a fan of is Q10. It's Coenzyme Q10. It's an excellent anti-inflammatory. It's really, really good it's good for blood pressure. Most people, when we're younger, we can make enough of it. However, as we get older, if we're on certain medications like statins, we just can't make enough of it, and we don't have enough. It's actually really good for energy and cellular production as well. So Coenzyme Q10 is another one that I'm a big fan of, patients getting that, 100 to 200 milligrams. Again, it'll be on that slide. It is something that you want to take with a fatty meal. Usually, if you're having eggs for breakfast or a lunch, you're having some sort of olive oil or avocado oil or avocados. That's the meal that you want to take it in. Most of these can be taken during the day. Magnesium is the only one I really tell people to take at bedtime. And if you're really more plant-based or vegetarian, you might want to probably get some sort of B complex as well, because you're probably not getting enough B vitamins. Again, it's another one that you can get levels checked and just see if you need any or not. So I think I did good today, staying on time. I'm going to look through these questions real quick. And your plant-based diet, which is wonderful. Why should we limit omega-6s? Great question. So you can actually, omega-6s we find are, I hate to use the word pro-inflammatory because I don't want to say that word, but we know that omega-3s are, and it's the ratio. Okay, let me back up. So when your omega-6 to 3 ratio, ideally you want about 4 to 1. Okay, that's how much omega-6 to 3 you want, 4 to 1. Most people, when you get your omega level checked, which you can actually get that level checked too, I do it quite often, because some patients eat a lot of fish and they say, do I need to supplement, or am I good on my omega-3s? But if you eat a standard American diet, I call it the SAD diet, most of the time omega-6 to omega-3 ratio is like 15 to 20 to 1. And we do know that ratio, if it's more than 4 to 1, is inflammatory. It's that ratio being out of balance. So again, if you're 5 or 6 is your ratio, it's probably not that bad. But then when you're looking at 10 to 15 to 1, then you're looking at a lot of inflammation going on because of the imbalance in the omega-6 to omega-3s. Omega-6s are good, like I said, but most people get enough omega-6s in their diet. So you never need to supplement. So if you're going to supplement with the fish oil omega-3, which I'm also a big fan of, you really just need a 3. You don't need a 3, 6, 9. You don't need a 3 and a 6. Just focus on getting a really good quality omega-3, because you want to get one, that has a brand that's been known to test for mercury and that's a pure quality. So great question, Jean, on the omega-3s and the omega-6s. That was great. Blueberries are great. What is the best protein for vegetarians? Great question. So I think the best ones are, the pea protein is a great protein to have. They have a lot of like the Vega One brand I know has, and let's talk about protein powders real quick. So when you look at a protein powder, whether it's whey protein, egg white protein, or pea protein or any of those proteins, you want to make sure that in the ingredients, a lot of times they sneak in sucralose, which is Splenda. If they're using stevia or monk fruit, I think that's okay, but be careful again about how many ingredients they're putting in that protein powder. So I think pea protein is a great vegan vegetarian protein. I personally don't like pea protein. I hate peas, so I don't do that, but I actually found a really good sunflower seed protein. Hemp protein can be good, but hemp protein is high in omega-6. So personally, I feel like I get enough omega-6s with, I eat pumpkin seeds and sunflower seeds and nuts. I get enough omega-6s with that. I don't want my protein powder to have too much of the omega-6s. So you know, hemp protein is also another one. A lot of times they blend it, so they'll have a little bit of hemp protein, a little bit of pea protein, a little bit of rice protein, and that's also a great option. So great question on the best protein for vegetarians. Apple cider vinegar. Yeah, so, you know, I think apple cider vinegar, there's a lot of myths about apple cider vinegar. I definitely think that the things that they have shown some studies on for apple cider vinegar is that if you drink some of it in the morning, it can help with cutting down on some of the absorption of some of the carbohydrates. So I definitely think that can be helpful. I know a lot of people in the morning will have hot water. I mean, I start my morning every day with a little small hot water, and I put lemon, and I put a little bit of spice actually to boost my metabolism with the red chili, and I put turmeric. And that's my little shot in the morning. I used to do apple cider vinegar too, so I think that's fine. I think that's fine too. I definitely don't think there's harm, but I wouldn't believe maybe all the hype about it, but it definitely can help. I don't know if it necessarily helps blood pressure directly, but it can help decrease some of the absorption of some of the bad carbohydrates. As far as, what about beer? Good question. So when you look at alcohol and what kind of alcohol to drink, really it's any sort of alcohol, to be honest with you, whether it's beer, red wine, white wine, vodka, gin, etc. The thing is, you know, you want to be careful with how much, if you're saying, can you have 2 cocktails? It's a little bit different because, you know, how much stuff they put in the cocktails, right? I mean, with all the sugar and extra this and extra that, it's usually way higher in sugar and carbohydrates and calories having a cocktail. You're talking about straight drinks, like a drink of, you know, of vodka is like an ounce and a half. That's one. That's considered one. Beer, you know, is 1 beer, I guess, is just the regular bottle. So I think that can have some benefit, actually, any sort of alcohol. But again, I would limit it to 1, maybe 2 a day. Red wine itself has resveratrol. Some of you may have heard of that. It's in the grapeseed. It's an excellent antioxidant, anti-inflammatory, but you got to drink like a whole bottle of red wine to get that benefit. So don't drink red wine to get resveratrol. If you really want, you can just supplement for it. I drink organic hot tea to fight inflammation. Is that, yeah. So turmeric, again, you know, if you're doing, okay, so turmeric is one that you can do pure. I think it's great. Anything that you can try to get vitamin-wise from foods, that's what you should do, okay? That's why I'm not a big fan of people taking vitamin C and vitamin E and vitamin A. I mean, those you should be getting plenty of if you're eating a balanced diet and fruits and vegetables and nuts and, you know, all that kind of stuff. You shouldn't need to take vitamin A and E and all those extra things. Even vitamin C, I mean, the only time I really think it might help to take vitamin C is if you feel like you're coming under the weather, then maybe for those few extra days, bump up your vitamin C. But on a regular day-to-day, you should get enough vitamin C with all the fruits and vegetables you should be eating. Turmeric, you can do turmeric in the spice, which I think it's great, but you need like almost 3 teaspoons a day, and you can't even do the 3 teaspoons all at once because your body's not even going to absorb more than a teaspoon of turmeric a day, and it's very strong. It's a very strong flavor. So you can do it. It definitely is not going to hurt, but if you want the strong effects of specifically turmeric and anti-inflammatory, then you probably need to supplement. The other last thing I'm going to talk about is I get a lot of questions, and they're on calcium pills. I do not think people should take calcium in pill form. There's just too many studies that are showing that calcium in pill form actually can go to the heart and not stay in the bone where you want to. Calcium, get in your diet. Almond milk, cheese, yogurt, greens have tons of calcium in it. I think we forget that greens have so much calcium in it. If you have to take calcium, because someone told you, some doctor said you have to take a little bit, take as less as possible, but at least take it with vitamin D and magnesium, and even vitamin K2, because that helps at least the calcium stay in your bones and away from your heart, where I don't want it in your heart. My blog is drmonashah.wordpress.com. And so it's just my name, drmonashah.wordpress.com. Has a lot of information about vitamins. I have a whole article on sugar, CoQ10, turmeric. I actually just put one out about calcium and vitamin D and magnesium and vitamin K2. There's lots of stuff on stress, meditation. So feel free to go on there and sift through whatever articles you feel like would speak to you. You can click on follow there too, and you'll get my future articles. But it's all basically on heart holistic health. So with that all being said, I am going to wrap it up, and I hope this was helpful, and I hope you guys got some good quality information, and everyone take care and do the best you can with eating. Remember, it's 80-20. Try to do the best you can most days, most meals, and then when you have a splurge meal or a splurge day, or not a whole day, hopefully a splurge meal or two, enjoy it and don't feel guilty about it. Okay, take care. Bye.